Hi, I'm Dr. Brian McGee, physical therapist with Rexercise. In the first video in this series on rotator cuff tendinopathy, I talked about the anatomy of the rotator cuff and some of the possible causes of damage to the tendons of the rotator cuff. So, quick refresher, the rotator cuff is a group of 4 muscles in your shoulder. Their job is to both move the arm and, maybe more importantly, stabilize the ball within the socket of the shoulder. Frequently, the tendons of some of the rotator cuff muscles wear down with repetitive use and/or with age. In the first video, I demonstrated what I call my Phase 1 shoulder strengthening and mobility home exercise program. These are the exercises that I most often give patients with this injury to do at home during the first few weeks of physical therapy to complement what we're doing in the clinic. In today's video, we'll simply progress the intensity of the program to adapt to the progress that patients typically make over those first couple weeks of therapy. Here's Phase 2. Okay, our first exercise in our Phase 2 program we call resisted or anchored resistance external rotation of the shoulder. So to do this, you'll need a rubber band, which if you're my patient I've given you. Simply secure it in the door as I have here or on maybe a heavy piece of furniture. You'll also need a towel. You don't need a real thick towel, just, a smaller bath towel is fine. So this goes under the hurt side arm. My hurt arm's my left arm. I have a 90-degree bend in the elbow, which I maintain throughout, and I simply rotate the shoulder in and out against the resistance of the band. So notice the band is tight throughout the cycle of movement. I don't get to the beginning of the movement and have a floppy, loose band. It's tight throughout the movement. 10 to 15 repetitions, 2 to 3 sets. What we're trying to work here specifically are 2 muscles, teres minor and infraspinatus, 2 rotator cuff muscles, and again they're helping to stabilize the ball in the socket of the shoulder. The next exercise we call the T exercise. What we're trying to work with this particular movement is a specific shoulder blade muscle called middle trapezius. It's one of the stabilizers of the shoulder blade. So now you're going to take this band, so it's basically folded in half with a knot in the middle that helps secure it in this door, okay? You're going to grab both ends, we're actually working both sides, and I'm going to turn around so you can get a better view of what we're doing. So you're simply going to pull the arms out against the resistance of the band, and you sort of look like a letter T. You're trying to pull the shoulder blades a bit together as you get to the end of the movement. You're trying to keep the shoulders down a bit. You're not shrugging in this manner. Keeping the shoulders down. Keep the turtle out of the shell. 10 to 15 repetitions. 2 to 3 sets. Okay, the next exercise we call the Y. The last one was the T. Our arms are out straight to the side. We kind of form a letter T. Our next one, our arms are going to be above our head. Our hands are going to be above our head, okay? So with the same anchored band, and again I'll turn around so you can get a better view, you're simply going to raise your arms up like you're doing the YMCA dance. Again, trying to keep the shoulders down a bit, not shrugging the shoulders, keeping the shoulders down. Up and down 10 to 15 repetitions. 2 to 3 sets. This one gets pretty tiring. Now what we're trying to work here primarily is a muscle called lower trapezius, again one of the stabilizers of the shoulder blade. In addition, it works most of the rotator cuff muscles as well, but that's what we're really targeting with this particular movement. Okay, our next exercise we call the wall angel. This is a stretch to both the shoulder and upper back. As I mentioned in our first video in this series, stiffness in the upper back seems to play a role in the rotator cuff wearing down a bit over time, and so we're frequently stretching it. So anyway, you're going to stand against the wall, feet are a little bit away from the wall, butts against the wall, mid-backs against the wall, heads against the wall. Trying to keep the back of your hands and fingertips on the wall as you reach the hands up and down as if you're laying in the snow trying to make a snow angel. Now, if you're from the upper Midwest like I am, you get that. If you're from a warm weather place, maybe you don't get that, but I think you get the point. So again, keeping the hands against the wall as you move up and down. As you reach up, it'll get pretty stretchy both in the back, kind of shoulder blade area and shoulders. Up and down 10 times. Okay, our next exercise we call banded shoulder raises. So you're going to use this rubber band loop. We're targeting a particular muscle here in addition to the rotator cuff, but a muscle called the serratus anterior muscle, which is again one of the shoulder blade muscles. Its main job is to not only stabilize the shoulder blade against the rib cage, but help the shoulder blade rotate upward, which you need to reach up. Approximately 50% of our upward reaching is the ball and socket moving. The other approximately 50% is the shoulder blade pivoting on the rib cage, and serratus anterior is the main mover in that series of movements. So anyway, you're going to take the rubber band, maintain outward pressure in the band as you reach up and down. Now notice I'm keeping my elbows in. I'm not, as I say, chicken winging, okay? Elbows stay in as you reach up and down. About 10 repetitions, 2 to 3 sets. Okay, our last exercise is also working that serratus anterior muscle that we did in our prior exercise with the banded raises. For this next one, we need one of these sliders. Now the cheapest way to get this is to go to the hardware store and get those sliding pieces of plastic you put under furniture to move them around. Works great for this, okay? You can get the workout ones, but they're just a little more expensive. Anyway, so in this exercise, I'm working my left side. My left side is the stabilizing side. So here's my hurt arm. With the unhurt side, I'm using the slider, and I'm simply going to reach to 3 positions. I'm going to reach as far as I can to my 12 o'clock and come back, and as far as I can to my 1:30 and come back, and then as far as I can to my 3 o'clock and come back. So the point of this is I reach further and further away. More compressive force is born on this extremity, and that serratus anterior muscle has to engage to a greater degree. And I simply reach to these 3 positions 15 times, 2 to 3 sets. That's the Phase 2 rotator cuff tendinopathy home exercise program. Again, if you're my patient, this is your reference for your home program, and this will complement what we continue to do in the office. If you're not my patient, obviously, and as always, work with your physical therapist as to what's best for you. I hope you found this video helpful. I hope it helps you get back to what you love to do. Please like or subscribe. I'd really appreciate it, and we'll see you in the next video. Thanks.